Okay, we're good to start.
Yes, ma'am.
Okay, great. Good evening, everyone. Welcome to the webinar this evening about navigating the healthcare after federal cuts that were just passed last month. We're really happy that you're with us tonight. There's a lot to learn and a lot to do. And so we welcome all of you, both who are joining us via the Zoom webinar and also those who may be following this on Facebook Live. My name is Mara Collinsgrew. I'm the Director of Policy and Advocacy at New Jersey Citizen Action. And for those of you who may be new to us, New Jersey Citizen Action is an organization has been in the New Jersey for more than 43 years now. We're engaged in a number of core issues, which you can see on the slide here tonight. Of course, we will be diving deeply into healthcare. We do research, education, training, and advocacy around these core issues. We also are an organization that has a large direct service arm. We help people with tax preparation, financial coaching, home buying and foreclosure counseling, as well as healthcare enrollment. So we are very happy that you're here with us today. If you are not already signed in to New Jersey Citizen Action, we do not share our lists. You can go to njcitizenaction.org and actually join, so you will receive information as we put it out on this and other core issues. Citizen Action has long fought for access to quality, affordable healthcare. And tonight, what you are going to hear is an overview about what is changing as a result of the GOP bill that made massive cuts to our healthcare programs in order to give substantial tax breaks to the wealthy. You're going to hear about what's changing, who will be impacted, and most importantly, what you can continue to do with us and continue to fight forward as we deal with these cuts coming online. You will get, before we leave this webinar, you will also hear about one of the most important things that you can do, which is taking action. We are together able to move and change the trajectory of these cuts. We are dealing with them now, but there are ways in which we can change what has happened here. And we look forward to working with all of you who are interested in moving forward to hold those representatives accountable who voted for these cuts and to work toward changing what you're hearing tonight. So without further delay, I'm pleased to introduce Laura Waddell, who is known to many of you. She is the director of our healthcare programs, and she will be our presenter for tonight. So I'm going to turn it over to Laura. After Laura does her presentation, we will be taking your questions. We have some questions that were submitted with registration, but we welcome those of you who have questions as the webinar progresses to enter your questions in the Q&A. For those of you on Facebook Live, you can enter them on Facebook. We will be monitoring both, and we will get to as many of your questions as we possibly can. So thank you all again for joining us. And Laura, I'm going to turn it over to you.
Thanks, Maura, and welcome again, everybody. I am going to start with just a really quick overview of what we're looking at here. So the Congress and the federal administration have passed the largest cuts to healthcare that this nation has ever seen. Over $900 billion in cuts to healthcare. That's to Medicaid, Medicare, and the ACA. There's an estimated 17 million people nationally that could lose health coverage. $330 billion in cuts to education, $230 billion in cuts to SNAP. So there are a lot of changes coming, and we wanted to talk and go through what we're looking at in regards to healthcare. So New Jersey Family Care, our state's Medicaid, has about 1.8 million enrollees. And there are over 500,000 of those enrollees are what's called in the expansion group, the Medicaid expansion group. And so we are wanting to know who makes up our Medicaid enrollee population. It's so many of us of all ages. There's children, there are working age people. So our seniors, 4 in 7 seniors that are in nursing homes, 1 in 3 children, 1 in 3 people with disability. And we have our, of course, there are a majority of the people who are enrolled in Medicaid are working in New Jersey. So 64% of adults in New Jersey Family Medicaid are working individuals. Medicaid also accounts for about 1/3 of the births in our state, and 68% of non-elderly Medicaid enrollees in New Jersey are persons of color. So the impact of these cuts, we will see the New Jersey Department of Human Services is estimating that we will see up to 350,000 enrollees lose their health coverage, unfortunately. That's about 1 in 5 or 20% of the enrollees on our Medicaid rolls. And I know a lot of the provisions of the bill that was passed. I know you probably heard a lot about them, and there's a lot to know. And there's also to note that a lot of the provisions are timed. So some things are happening immediately, some things are happening over time. And by the end of it all, we will have seen about $3.6 billion in less funding or funding cuts to our New Jersey Family Care Medicaid program. The bill was signed on July 4th. And so from July 4th, a few provisions to highlight. There are reproductive cuts to healthcare. However, those cuts, the funding for those cuts is being paused for 1 year. So those funding cuts should be restarting a year from this July. So in July of 2026, the funding for reproductive health care is anticipated to restart. There's a cap on new provider taxes that became effective immediately. Starting October 1st of 2026, there are changes to what is called qualified immigrant statuses. And these changes are expected to result in up to 25,000 New Jersey Family Care enrollees losing coverage. Starting in January of 2027, there will be work requirements for those low-wage employees with incomes between $1,300 and $1,800 per month. So these provisions apply to those individuals in that population. So these work requirements will mandate enrollees who are who don't have children, or those adults who have children ages over 13 years of age, will be required to work at least 80 hours a month, or volunteer 80 hours a month, or to be enrolled in school. The eligibility reviews, as we know, that typically every year you have to go through redeterminations or eligibility reviews to re-enroll in and maintain your New Jersey family care coverage. These eligibility reviews for the low-wage population that I mentioned, the 1,300 to 1,800 a month population, will have to perform eligibility reviews every 6 months. And that's called the Medicaid expansion population. So for that population, there will be more frequent eligibility reviews, more frequent times you will have to apply for New Jersey family care. And retroactive coverage. So typically, if you are going through your application process and it's found that you are able to, once you were found to be eligible for New Jersey family care, you were able to have your coverage start retroactively. Now, for the Medicaid expansion population, the retroactive coverage will only go back 30 days. For the traditional population, the population that is under $1,300 per month income, that eligibility or retroactive coverage will go back 60 days for that population. And starting October 1st of 2028, the Medicaid expansion population will be required to have $35 copays for their doctor's visits. So you'll see that there are certain provisions that start certain times for certain populations, and so it's important just to know, which population you may be in, and so that you know to look out for when you might need to do your eligibility reviews, if it's 6 months, or if it's 12 months, or if it's 30 days for retroactive coverage, or 60 days. And of course, the work requirements and the copays. We do want to note that our Cover All Kids, we are optimistic, tentatively optimistic, that the program is safe. We have almost 47,000 undocumented children enrolled, and we're hearing that tentatively that program is safe for now. I wanted to also go through some of the impacts and provisions and changes that you need to know if you are enrolled in Get Covered NJ or ACA Marketplace. So beginning this month, beginning August 25th, DACA recipients will be ineligible to enroll in Get Covered NJ ACA Marketplace coverage. As you know, they just started, they just received eligibility last November. And so this year, DACA recipients have been able to enjoy coverage on the marketplace, our state exchange. However, starting August 25th of this year, those enrollees, those DACA enrollees, will no longer be able to continue their enrollment with ACA Marketplace coverage. And it's estimated at around 500 enrollees this will affect in New Jersey. Also, we should note that the new policies pause year-round enrollment for low incomes. That's for people who earn a little over $23,000 per year and below, up to the limit of the enrollment threshold for Medicaid. But for those who make $23,475 and less per year, this is paused, unfortunately. This is one of the great removals and barriers to coverage that New Jersey has put in place. And unfortunately, because of the new rules, federal rules, this is being paused and will restart starting next August. So August of 2026, this low income year-round enrollment will restart. And so this December, at the end of the year, December 31st, there are about $500 million in New Jersey ACA premium tax credits. They will expire. And tax credits are what really helps to make premiums and state exchange coverage more affordable for people who are enrolling. And these enhanced premium tax credits will be expiring. Not all of the tax credits, but the enhanced premium tax credits. The additional financial assistance that came out of the Inflation Reduction Act a couple of years ago that made the purchase of ACA plans more affordable, those enhanced premium tax credits will be expiring at the end of this year. And so starting January 1st of 2026, they are removing eligibility for certain lawfully present immigrants and refugees. Gender affirming care is no longer covered as an essential benefit. And there's an elimination of an income change as a qualifying life event for the special enrollment period. And what that means is, as we know, we have our open enrollment period in New Jersey because we have our state exchange. It has typically been from November 1st through January 31st. And between February and the end of October, that is the special enrollment period. And so during open enrollment period, there's no stipulations that you need to meet necessarily to enroll during open enrollment, but in special enrollment, you do have to have experienced a qualifying life event in order to enroll in special enrollment. Qualifying life events could be if you moved or if you had a change in your family, such as if you got married, if you got divorced, if you had a baby. Different qualifying life events are acceptable to be able to enroll during special enrollment, and you have to have had these qualifying life events within the previous 60 days in order to take advantage of special enrollment. Well, starting in January of next year, one of those qualifying life events used to be a change in income. That is no longer an option to be considered a qualifying life event. You will have to have, even if you did have a change in income, you will have to have one of the other qualifying life events in order to be able to enroll during special enrollment. So that starts January of next year. And I know we just spoke about our open enrollment period. However, there will be changes next year. This year, 2025, our open enrollment will be as normal in regards to the period of time. It will be November 1st of 2025 through January 31st of 2026. Starting next year's open enrollment period, November 1st of 2026, open enrollment periods will be cut down and shortened. So for New Jersey, it will most likely be November 1st through December 31st. So only 2 months instead of 3 months. And then there will also be new income verification requirements that all enrollees will have to satisfy when enrolling. So this just is an example to show you of the impact of some of the rolled back of the financial assistance that our Get Covered enrollees are looking at. So we have over 454,000 Get Covered enrollees who are in that, as I was telling you, the received enhanced premium tax credits. So over 450,000 of the enrollees received those. Enrolled in the whole state exchange is over 514,000 people. So a good portion of the enrollment population of our state exchange do receive enhanced premium tax credits to help make their coverage and premiums less expensive. So these enrollees are looking at a premium increase of an estimation of 110%. So they will more than double their premiums because of the expiration of the enhanced premium tax credits. So that's 88% of enrollees will be paying more. And just to give you an idea, for a individual who's enrolled on the state exchange, they should be seeing an estimated $1,260 more, an increase of $1,260 in their premiums, or a family of 4 will see an estimated $4,168 dollar increase in their premiums. So premiums are expected to rise because of this. For older enrollees, the increase could be higher. And just as a national picture, it's anticipated that 5.1 million people across the country will see their premiums increased because of the expiration of those enhanced premium tax credits. We will also see impacts to our Medicare population. So beginning with the signing of the bill on July 4th, there is now a pause in the implementation of minimum staffing standards for long-term care facilities. This will restart in 2034. So where the previous administration set new standards for minimum staffing requirements in these facilities, now because of the new policies, the implementation of those standards has been put on pause, and the pause will be a number of years. It's not due to be implemented until 2034. There's also a moratorium on certain Medicare savings programs eligibility and enrollment provisions that started immediately in January of next year, January 1st and beyond. The negotiation power of Medicare for their Medicare negotiated drug prices, the negotiated power has been weakened. This population will see some delays in the implementation of lower drug prices for certain drugs that were already negotiated by Health and Human Services. And in July of the following year, July 4th of 2027, Medicare coverage limitations for immigrants will take effect. So that's a lot. We've taken a look at changes and impacts to New Jersey for New Jersey Family Care Medicaid. We've also taken a look at changes for Get Covered NJ, our ACA Marketplace, and we've taken a look at how there will be some changes to our Medicare population as well. And so we also wanted to let you know that there will be impact felt and cuts to funding of our hospitals and new federal policy changes there as well. And so beginning October of next year, October of 2026, cuts of $3.3 billion in federal funding to New Jersey hospitals. And so this is over a period of time from 2026 through 2029. Also, states are not able to claim what's called FMAP or matching funds for non-qualified immigrants, and that also takes effect in October. And there's a capping of $360 million in annual Medicaid reimbursement through provider taxes. And there's a caveat of exempting nursing and intermediate care facilities, but that is also will be impacting hospital or providers. And of course, all of these changes is expecting to see an increase in charity care cases in our hospitals and healthcare facilities. As you all may know, our state has federally qualified health centers in all counties of the state. We have 23 centers across 138 sites. They serve over 600,000 residents, regardless of their ability to pay, regardless of their immigration or insurance status. And there is a pending change by the Federal Health and Human Services that will change an interpretation of a rule that would ban undocumented individuals from accessing healthcare at federally qualified health centers. And so we can talk a little bit more about it in a bit, but there is a federal comment period that ends August 13th. And so you and your organizations can submit comments to oppose this new interpretation. And we would encourage you to participate and engage and submit a comment on behalf of your organizations or yourselves. And thank you, Mumtahina. And if you would like to receive a template of a template comment so that you can easily customize it for yourself, for your organization, please complete the poll that is up on your screen right now. And we will, everyone who completes the poll, we will send you an email with an attachment that has this template, this comment template, federal comment template. I'm going to give you a few more moments to complete that poll. And while you are completing it, I did want to say that, and again, we can talk about this again in a couple minutes, but I will say that our Attorney General, Platkin, is fighting a lot of the implementation of a lot of these policies. This one in particular they have been able to get a bit of a delay in the implementation of this particular change. And so the states, along with other states who have joined in with the lawsuit, the opposition to this rule, the delay of this implementation has been delayed to September 4th at the moment. So, you know, it's still great to be able to submit your comments, and helps to grow the more opposition that is received and seen, and as part of the record, it can only help our chance. So thank you so much. It looks like the responses has slowed, so we'll just, I guess we'll put the poll down then. Great. And so, as I mentioned, our Attorney General has been very busy in trying to stop many of these, the implementation of these harmful federal policies. He is fighting, along with a number of other states, fighting the denial of access for DACA recipients to ACA coverage. That is a current suit that he has filed. He is also trying to stop the implementation of that rule that we just mentioned, that will prevent undocumented individuals from accessing healthcare at federally qualified health centers. He's also working to stop any illegal sharing of personal health data of our undocumented individuals' personal health data as well. So these are just a few of the many actions that our Attorney General and his office have been taking on behalf of our New Jersey healthcare consumers, patients, and residents. So I wanted to share with you some resources that are available to you now. One is, you'll see on the one side of your screen, it's just a one-page kind of fact sheet on some of the highlighted provisions that are taking effect and when they will take effect, and some of the impact that they will have on New Jersey. And so it goes through all of the things that I've said, in regards to impacts to New Jersey Family Care Medicaid, Get Covered NJ, our state marketplace, Medicare, and even also mentions immigrant access to healthcare as well. And so you can access this fact sheet. You can download it at njcitizensaction.org/BBB-impacts. And we'll be sure to put a link to that fact sheet and site in the chat. And we know that with all of the reduction and the loss of health coverage this state is going to see, we did want to let you know of a new resource in regards to medical debt, because medical debt will be, unfortunately, also one of those things that will be increasing and on the rise. And so there's a new website resource for our residents, regardless of your immigration status, regardless of your insurance status. You can go to endmeddebtnj.org, and it will provide many resources about how to navigate medical debt, medical billing, in your insurance appeals. If you are, unfortunately, if you've been sued and you're not sure how to navigate the court process, this provides information for you and some suggestions there. So, and a lot of resources as well. So I think that is I can turn back to this if we want to during our Q&A, but I just from some of you had entered some questions ahead of time and wanted some specific examples as to how different scenarios of impact. And so these are just a few different scenarios for that. Mara, should I save this for Q&A time or?
No, I think you can go right ahead, go through that.
Oh, okay. All right. So just a few examples here. One you see here is James. He's an Uber driver. He has an income of $1,500 a month. He does not have any children. He's enrolled in New Jersey Family Care. And he, in addition to being an Uber driver, he's the primary caregiver for his elderly mother. So after these new policies take effect, James will be required to prove that he maintains 80 hours of work per month. He will have to start paying $35 in copay for doctor's visits, and he will be required to reapply for New Jersey Family Care every 6 months. In the middle here, this is Mary. She's 40 years old with her daughter, Emily, 5. Mary's annual income is $85,000 per year. Emily has a chronic medical condition. They're both Get Covered NJ Marketplace enrollees. They currently receive $193 per month of an advanced premium tax credit and $100 per month state subsidies towards their premiums to make them more affordable. And as of January 2026, their monthly premiums are expected to increase between $1,300 to $4,000 more. Their federal premium tax credits will be reduced, and their state subsidy would not be able to make up for the loss of that of the gap in the federal tax credits that they were used to receiving. And the last is Martin. He's a 90-year-old nursing home resident. He resides in the memory care unit. And after the new policies take effect, one of the impacts to Martin will be that there's a delay in the implementation of the previous administration's new long-term care minimum staffing requirements. They're being paused for a number of years. And so, hopefully this kind of gives an idea of, just how these new policy changes will be impacting people's everyday lives. And I guess I should say everyday people's everyday lives. And I will turn this over to Mara or to Liz.
So Laura, before we go to take actions and what we can do, maybe you can go back to the previous slide or just, yeah. We have a lot of questions, a lot of information, a lot of comments from people that they're really happy, pleased to be learning about what all these things are contained, really learning about what the cuts are. And so I'm just going to start with some questions that have already been entered into the Q&A and into the chat. There's a couple that are have been repeated by several people. So just for clarification, because a few people asked this question, what is the difference between Medicaid and NJ family care?
Thank you for that question. New Jersey Family Care is what this state calls its Medicaid program. So New Jersey Family Care and Medicaid are the same.
Yeah. Well, thanks for the clarification. Lots of people had a little confusion on that. The other thing is that we've been asked to clarify. There's a question from Judith who wanted to know if someone is working less than 80 hours but going to school as well, are they eligible? Will they remain eligible for Medicaid? And also, do trade schools count as being enrolled in school?
Those are all really great questions. I will say I haven't seen any advice specifically to those questions, but I will say what I believe in my understanding. So trade schools, I would imagine that would qualify, 80 hours. It says 80 hours of school, or have to be enrolled in school, I'm sorry. So I would imagine that would count. And in regards to the split between 80 hours of work and 80 hours of volunteer work, I have to say I'm not sure. I would have to get back to you on that. I could, these are it's been, a month. Yeah, it's been 1 month since the passage of this bill, and I am still learning I learned actually some things today. So I'm still learning a lot about what's in it. A lot of people, our national partners, are still learning and combing through it, because it was pages upon pages upon pages of policy and provisions included in this bill. So that's something that I can see if there's an answer for you, or we may have to wait and see in the coming months as more detail comes out about, the eligibility requirements for work requirements.
Yeah, thanks for that clarification, Laura. And just to, emphasize, what you've, been saying, Laura and advocates across the country are still learning about this bill and the actual implications of some of the impacts. We will see down the road regulations being issued about how these changes will be rolled out. So we hope that you'll stay connected to Citizen Action to learn and continue to learn about what will happen moving forward, and also what you can do and how you can get involved. So tonight we'll answer as much as we can. We have some other questions. You talked a little bit about the added costs to those in the ACA Marketplace programs, the increases in premiums. And we have a question here, whether or not this bill will impact premiums for schools, businesses, individuals, and those outside of the ACA Marketplace.
That's a good question. I have been saying that, everyone should be concerned, and everyone should not think that if they're not enrolled in New Jersey Family Care Medicaid, or if they're not enrolled in ACA coverage, or if they're not in Medicare, that don't think that you will not be impacted, because this will essentially impact all of us in some form or another. I often, think about even within these programs, if there are changes to certain populations, it will still impact everyone else. For example, we said that there are 4 out of 7 nursing home residents are enrolled in Medicaid. Well, if the facility is receiving less for those 4 individuals, the cost of healthcare and keeping those residents at that facility is not going down. Only some of the funding that was helping to cover the costs. So those facilities will have to make up for that difference somehow. So I would anticipate that the other folks may see a difference in costs for them. So it's going to impact us all in one way or another.
Thanks for that. We had several questions submitted as people registered, and I wanted to just see if you could shed a little more light on this. You did talk about the Cover All Kids program for undocumented kids that we expanded here in New Jersey, and we're very proud to do so. Can you say more? Will that continue to be a program in New Jersey Family Care for this year and beyond?
For this coming year, it has been allocated in the new budget, the fiscal year 2026 budget, state budget. All indications that we've been hearing from the Department of Human Services continues to say that the program will continue to be supported in the new budget. But I, say that that was in the midst of, all of the departments have been ordered by the governor to evaluate the cuts and how they're impacting each of the departments and what can be done. And so, I feel pretty good that the program will be sustained in this new budget year coming up. But I, wouldn't feel comfortable saying, 100%, because we just don't know, where the dust will fall after they do their reviews. But I do, so far what we've been hearing is that the support still remains for that program. And so I feel pretty good that it will at least be here for the next coming year.
That's great. That's great. Thank you. So we have a question from Thomas who asked, I know that you have worked a lot with the Department of Human Services, and while we can't speak for them, can you shed any light on what DHS is doing or will be doing to help expedite renewals of people applying to New Jersey Family Care?
I believe that they are also looking at. I attended one of the medical assistance advisory council meetings, one of the last ones. And I believe I remember it mentioned that they were still looking into, seeing what flexibilities would be allotted to states with the new rules. I in one of the past council meetings, they also mentioned a new auto renewal mechanisms that would be, I think, starting this July. I think that I'm remembering that properly. Maura, is that what you
I think
remember?
that is right. The automatic renewals are the online renewals. I'm sorry.
Yes, so those are those are some of the things that I've heard. And again, just with 4 weeks from signing, there's still more to learn, more details to find out about, and more information to gather from the state just about how they are responding to all of these changes. So there will be more to come. So I guess that means we'll probably have some more of these webinars.
I think we may need to. And I will just add to that, that one of the implications and the impacts that you talked about from all of these changes is it puts an enormous added administrative and cost burden on our Department of Human Services, right? Changing eligibility determinations and reviews for 550,000 people from every year to 6 months requires them to do double the work. That costs money, that takes staff time, it takes resources. So, the cost benefit of, kicking off so many people in coverage, really doesn't add up. There are a lot of things here that are going to cost states more money. And in 2026, New Jersey and every other state will have to grapple with the impacts to state budgets, because of these changes. And so the ripple effect, as Laura said, will be felt not only across healthcare, but across all programs as states need to try and fill the gap and the added cost burden that is being placed on them by these changes. So we are getting to time. And so just one other thing I wanted to reiterate. Many people asked about whether or not we will be sending out a follow-up. You will receive these slides. Those of you who requested will also receive information about how to submit a comment to Health and Human Services about the changes and the cutting off of access to immigrants and immigrants that we invited here, refugees, those with temporary protected status, those who have sought asylum. There's a number of provisions that are contained in these proposals that simply, in our view, are outright cruel. So we do hope and we welcome all of you to rally your organizations, or as an individual, you can also submit a comment. We will provide that information to you, and comments are due by August 13th. So you will receive more information on that, as well as the slides and additional follow-up. In the slides will be the actual links to those resources of End Medical Debt, as well as the fact sheet. We encourage you to take that fact sheet, to print it out. If you need additional information, or if you want to host a educational session or webinar for your organization, we are happy to speak with you about that. So with that, I'm going to turn it over to Liz, who's going to talk about ways in which talk about what you can do and ways in which you can take action in the immediate future and beyond.
Great. Thanks, Maura. So there's, a lot that we can all do to make sure we're raising some more awareness and educating more people around us, because we know one of the key things that really we need to make sure people understand is just how impactful this bad bill was, right? We know unfortunately, the representatives who supported this bill are saying things that are not correct, right? And so it's really important for us to get out there and have conversations, and really make sure we're talking to our own communities and our own networks about the impacts. And so that's one reason why we shared with you the fact sheet. We will share with you all the recording of this webinar. And we want to make sure we're just getting the word out about just how impactful these cuts are going to be for all of us. Second, we are still collecting stories from people who will be directly impacted. And so if folks have stories, we will, I'm actually going to put Laura, your email in here so folks can contact you directly if they have stories of folks who will be impacted. One thing that we do is work to kind of uplift these stories to really kind of show the great impact that they'll have. And so the stories are really put a human face to these numbers and really help us illustrate just how severe these impacts will be. And then, look out for actions in the targeted districts. So the reps who voted yes for this bill in New Jersey are Representative Congressman Tom Keene Jr. He represents CD7. That's in the it's Congressional District 7. It's in the middle of the state. So it goes from like Rahway west. And so it goes through parts of Union County. It goes parts of a good chunk of most of Somerset, all of Hunterdon County, all of Warren County, and then parts of Sussex County. And so especially if you know friends or family who are in that district, or you yourself are in that district, really encourage you to reach out and continue to put heat on Tom Keene Jr. to hold him accountable for this vote. Representative Chris Smith is Congressional District 4, and he represents a lot of the Jersey Shore area. in like Monmouth and Ocean County. And then Representative Congressman Jeff Van Drew is Congressional District 2, and that is more south, so like Atlantic City, and then the south part of the state down to Cape May and the Delaware Bay area. And so then we'll go, when you go to the next page, actually there's an action you can take here. So actually here, if you want to tell us your story, this is a QR code, but you could also I put Laura's email right here in the chat, so folks can email Laura directly if you have a story. And then here's where you can take action and contact your rep. So if you actually have your phone, you can take your phone out and actually just put your phone camera right up to this QR code. It will take you directly to our take action. This action is actually just for people who are residing in these 3 districts for the reps who voted yes on this bill. And this is a way for you to hold those representatives accountable, your representative, if you're in these districts, and let them know that you don't support these cuts. I also encourage folks, we're not going to get into how to do all these things here, but letters to the editor, social media posts, calling your representative, or even visiting your representative offices in person. Those are all also impactful ways. We're looking to definitely continue to hold them accountable. So, if you sign up to get our emails and follow us on social media, you also may see us getting out there and doing some more work. We did a lot to pressure these reps to hopefully make this not as bad. And unfortunately, they went ahead and caved to the pressure that they were receiving to vote yes on this bill. And they did not do what was right for their constituents. And we have worked really hard to hold them accountable, and we'll continue to hold them accountable. And we welcome you guys all to join us in this accountability. All these reps will also be up for election next year. And so the voters will have an opportunity to hold them accountable for these votes as well. I think that's most of what I have to cover here.
I think that's it. We really thank you all. This is information about our team. Also, you will get this via email. Please stay connected. We look forward to working with you, and please reach out if there is something that you would like. Citizen Action can be a resource to you. We appreciate you joining us tonight, and thank you all so much. That concludes our webinar for tonight, and we look forward to being able to update you as we move forward. Thanks so much.
Have a good night.
Good night.